7 nighttime signs of diabetes you should never ignore. It always began around 2:47 a.m. Evelyn would bolt upright in bed, drenched in sweat. The room was cold, but her body burned like a furnace gone rogue. Her sheets clung to her back like wet parchment, and her heart raced with no apparent cause. For months, the pattern repeated, like a haunting refrain that no doctor could explain. She wasn't having nightmares. She was living one. What Evelyn didn't know, and what many people don't, is that the night hides secrets, especially if you have diabetes. When the sun goes down, your body speaks in whispers. And if you know how to listen, you'll hear the truth before it's too late. Let's unveil the 7 warning signs of diabetes that reveal themselves in the silence of the night. Because sometimes, survival begins with something as simple as paying attention to how you sleep. 1. The midnight march, frequent urination, nocturia. For Thomas, it was the 3rd trip to the bathroom that did it. At 68, he chalked it up to getting older, but deep down he knew something was wrong. He would fall asleep just fine, only to wake up every 90 minutes with an urgent need to pee. It wasn't just annoying, it was exhausting. What he didn't know was that elevated nighttime blood sugar was quietly forcing his kidneys to flush out excess glucose through urine. It wasn't just inconvenience, it was a signal flashing like a red light in the dark. Nocturia is more than a sleep disturbance, it's your body's cry for help. 2. The sweating silence, nocturnal hypoglycemia. Evelyn's episodes weren't hot flashes. They were the trembling hands of nocturnal hypoglycemia, dangerously low blood sugar during sleep. Her body, lacking glucose, had gone into panic mode. Night sweats, vivid dreams, and morning headaches are often dismissed or misdiagnosed, but beneath them lies a more sinister truth: the risk of seizures or even slipping into a diabetic coma. And it happens quietly, when no one's watching. If you use insulin or certain medications, these episodes could be triggered by late dinners, skipped meals, or a strenuous evening workout. To fight back, monitor your glucose before bed, and keep fast-acting sugar at arm's reach. 3. The itch that won't sleep, restless leg syndrome. It started with a tingle, a subtle itch in her calves that grew more persistent with each passing night. By week 3, Evelyn was pacing her bedroom floor at midnight, unable to stay still. Her legs moved as if controlled by a force outside her will. Restless leg syndrome, RLS, is more than a nuisance. It's a sign of nerve damage, often tied to diabetic peripheral neuropathy. The elevated blood sugar that haunted her days had begun fraying the delicate threads of her nerves. RLS isn't just discomfort, it's deterioration, and it rarely comes alone. 4. The snore that hides a killer, sleep apnea. George was 55 when his wife left their bedroom. "I can't sleep with your snoring anymore," she whispered. What she didn't know was that her husband's thunderous snores were the sound of him gasping for air, over and over throughout the night. Sleep apnea isn't just about noise. It's a deadly trap that lowers oxygen levels and increases insulin resistance. George had diabetes, and every night his body fought to breathe while his blood sugar climbed in defiance. If you snore, feel fatigued after 8 hours of sleep, or wake up gasping, don't ignore it. Sleep apnea and diabetes form a vicious loop. One fuels the other, and both can destroy you silently. 5. The vanishing floor, nighttime hypoglycemia. Have you ever woken with your heart pounding like war drums, cold, confused, unable to remember what day it is? This is not insomnia. It's the dark heart of nighttime hypoglycemia, and it doesn't knock, it kicks the door in. When your blood sugar plummets too low during sleep, your brain's power grid dims. You dream strange dreams, you wake disoriented, and in the most tragic cases, you don't wake at all. Glucose before bed, snacks if needed, awareness. These aren't habits, they are lifelines. 6. Thirst that burns through dreams. Diana kept a glass of water by her bed, then a bottle, then a full pitcher. But it was never enough. She'd wake up choking on dryness, her mouth like sandpaper. This wasn't dehydration, it was hyperglycemia. Excess sugar in her bloodstream was pulling water from her cells like a tide draining the shore. Excessive thirst at night is a telltale sign that your glucose is out of control, and paired with nocturia, it becomes a cruel cycle. Drink, pee, wake, repeat. Thirst isn't just uncomfortable, it's diagnostic. It's time to listen. 7. The cramps that crawl from the abyss. At 3:11 a.m., it struck. A cramp that seized Diana's leg like a vice, locking her calf in unbearable pain. She cried out, but no one heard. Nocturnal leg cramps, sharp, sudden, and excruciating, are often the result of electrolyte imbalances, poor circulation, or nerve dysfunction, all of which are common in diabetics. High or low glucose levels alter the way muscles fire. Her body wasn't malfunctioning randomly. It was reacting, screaming. Stretching, hydration, and balanced minerals can help, but the real key? Controlling your blood sugar before it controls you. The night doesn't lie. Sleep is supposed to heal us, but for people with diabetes, night can become a battlefield, one filled with clues if we dare to look. Each of these signs, sweats, cramps, thirst, restlessness, is a sentence in your body's diary, a diary written in the dark. Evelyn finally saw a new doctor. She began monitoring her glucose at night. She adjusted her insulin. She started listening. And for the first time in months, she slept through the night. Are you listening to what your body says after sundown? The truth might be waiting in the silence between breaths. Because when it comes to diabetes, the night doesn't lie.